the scope, objectives, principles, and working methods of medical social work. Introduction. In this session, you will learn about social work practice in healthcare carried out directly or indirectly. What then is the scope of medical social work? What are the objectives and working methods of medical social work? Learning outcomes. When you have studied this session, you should be able to state the history and scope of medical social work, state the specific objective of medical social work that deals with the institution, identify the principle of medical social work that has to do with the environment, and state the two major working methods of medical social work. The history and scope of medical social work. History. In England between 1880 and 1900, after patients were discharged, visitors and nurses were asked to give advice to them. This marked the beginning of medical social work in England. In 1905, Boston medical institutions appointed medical social workers for the first time. In the United States of America, social work was based in the community in the 1880s, primarily through affiliation with agencies. Carson, 1981. Then, social workers addressed public health problems such as tuberculosis and infant mortality, syphilis, polio, and unmarried pregnancy. Direct social work practice in healthcare is traced back to City Hospital in Cleveland, where outdoor relief workers were used to clear the wards filled with chronic patients and homeless Civil War veterans. The professional stature of clinical social work advanced significantly in 1905 when Dr. Richard Cabot introduced medical social services at the Massachusetts General Hospital. From 1918 to 1932, a medical research led to technological advances and hospitals became strategic centers for medical practice. The role of medical social workers evolved. Kadoff and Malick, 1985. In the mid-1920s, the American Hospital Association, AHA, produced the first formalized articulation of medical social work. Norman, 1977. During colonial rule in Nigeria, the government was more concerned about issues of security, and missionaries were concerned about the health of the people, especially material and child welfare. Seram, 1991. Gradually, social work practice in hospitals spread to other parts of the world, including Nigeria. Medical social work is not just limited to the treatment of diseases, but encompasses prevention, care of diseases, and rehabilitation of patients. That is, it deals with those problems of the patients which are related to the physical and psychosocial environment. It is oriented towards the assistance of those people who, during their treatment, encounter social, physical, economic, and psychological problems. Objectives of medical social work. The following are objectives of medical social work. 1. Helping people having illness, trauma-related crisis, disability to understand and manage psychosocial impact of illness upon their lives and on significant relationships to make decisions and plans for the future. 2. Facilitating adaptive coping patterns to chronic illness or disability and assisting with reintegration to new environments. 3. Participating in teamwork and providing insight into psychosocial dimensions of medical illness affecting patients and families. 4. Identifying and arranging community supports and resources to facilitate discharge from hospital or transfer to alternative care facilities. 5. Assisting with anticipatory grief and mourning and providing other bereavement-related services to members of the family. 6. Assessing the needs of patients, planning and implementing appropriate programs. 7. Identifying potential neglect, abuse, and exploitation in vulnerable populations and involving authorized agencies. 8. Supporting institutional goals and purposes. 9. Encouraging institutional responsiveness to patients' needs. Principles of medical social work. What are these principles? Do you know that they are social techniques and humanitarian in nature? These working principles are enabling patients to solve his or her problems, determining social and psychological influence, developing willpower and determination of the patient, enabling patient to adjust to his or her problem, and developing proper environment. Working methods in medical social work. As there are working principles in medical social work, so there are working methods which terminate in good social work intervention. The major working method in social work is case study method. This means collecting information with regard to specific needs of the patient and working towards their fulfillment in accordance with the available means. Let us also know that case study method could be 1. Direct method of assistance. 2. Indirect method of assistance. Direct method of assistance. This is a method in which the medical social worker is directly involved in the assistance of the patient. This could be in form of social case work or social group work. Social case work. Here, assistance is provided by the medical social worker to the individual patient and or his or her family with the aim of developing his or her inherent capacity. Social group work. Here, medical social worker tries to strengthen the social relations of the patient and works towards the development of a healthy social environment for the patient. Indirect method of assistance. This is simply not a direct method, that is, not individualistic. It is a form of community organization, social administration, social insurance, social security, social action, and social work research. A. Community organization. This is when the medical social worker helps in the organization of community resources with regard to health programs. Social administration. This is when the medical social worker guides the public opinion for the enactment of a new social legislation or any amendment in the prevailing legislation. Social security and insurance. This has to do with scientific study of the mind, where the medical social worker assists the patient to utilize the facilities under social security and insurance. Social action. This is the participation of the medical social worker in the movements of social action at the national and international levels. Example, National Health Program involving the World Health Days. Social work research. Here, the medical social worker inspires surveys and investigations regarding social, economic, and psychological problems of the patient. Activity. Take a moment to reflect on what you have read so far. Based on your learning experience and knowing that social work has its history and scope, note down some historical dates in the history of medical social work. Feedback. Take a look at the figure below, which shows the various dates with their records. 1880, era of visitors and nurses advising discharged patients in England. 1980s, community-based medical social work practice in the United States of America. 1905, appointment of the first medical social worker in Boston Medical Center. 1905, introduction of medical social services at the Massachusetts General Hospital. 1920, the first formalized act of medical social work by the American Hospital Association. For us to meaningfully understand the broadness of medical social work, the scope of practice has to be known. The scope of medical social work is therefore represented in the figure below. The scope of medical social work. Medical practice is not just limited to treatment of diseases, and this is why medical social work is involved in the following assistance: social problems, physical problems, economic problems, psychological problems, preventive services, rehabilitative services. To successfully practice medical social work, there are certain principles to be followed, and these are stated as follows. Principles of medical social work. 1. Enabling patients solve his or her problem. 2. Determining social and psychological influence. 3. Developing willpower and determination of patient. 4. Enabling patient to adjust to his or her problem. 5. Developing proper environment. For an effective medical social work practice, there are certain methods of practice to be followed. Methods in medical social work. Direct method. A. Social casework. B. Social group work. Indirect method. A. Community organization. B. Social administration. C. Social security and insurance. D. Social action. E. Social work research. Study session summary. In this study session, you learned that medical social work has its developmental history dating from 1880 till date. There are many areas of involvement in medical social work, and it is not just limited to treatment of diseases. We also learned that there are 9 specific objectives of medical social work practice. There are certain principles that guide medical social work, ranging from individual focus to environmental focus. The methods of practice in medical social work could be direct or indirect. The direct method of assistance in medical social work is either case work or group work. The indirect method of assistance includes community organization, social administration, social action, social work research, social security, and insurance. End of study session 3. Thanks for listening.